We are discussing acute stroke management of ischemic stroke, that is pre-hospital. You will have to make a call. Code stroke activation is an important step in out of hospital diagnosis of stroke. Now, once the diagnosis is established, you will have to differentiate the patients into two varieties. One is early presenters, another is late presenters. So in case of early presenters, that is onset of stroke less than 6 hours, remember this duration asked in exams, less than 6 hours, perform a CT. CT brain shows that there is no hemorrhage. Then you will take this patient for an eligibility criteria for thrombolysis. Check whether this patient is eligible for intravenous plasminogen activator. Intravenous plasminogen activator or tenecteplase, alteplase are given here if the patient is eligible, if in the CT scanner room itself. So we are not waiting for transferring the patient into an ICU or a hi-fi setup to save time. After this, check for any occlusion in the major arteries. How do you check for occlusion in the major arteries? The second option here is, remember, if the patient is not eligible for IVPA, then what do you do? For both these, the answer is perform a CT angiography. So when you perform a CT angiography, check for three major arteries: internal carotid artery, check for occlusion in the first or second branch of middle cerebral artery, or basilar trunk, basilar artery. If the occlusion is present, this is a candidate for endovascular thrombectomy. Now, endovascular thrombectomy, nowadays it is a very much debated topic because recent stroke guidelines have preferred this as the first option in case of early presenter strokes. Next is, if your patient is a late presenter, after 6 hours, that is 6 hours to 24 hours, check for again CT scan. If there is no hemorrhage, then directly perform the CT angiography. CT perfusion. If you find that there is a favorable perfusion, then again this person is a candidate for thrombectomy. If you do not find a favorable perfusion, then you will have to manage the patient as an inpatient management conservatively.